Hi, I'm Brianna Seeley, producer for OffScrip Health. Welcome to the Heart of Healthcare. Before we get started today, I'd like to tell our listeners about another show on the OffScrip Health Podcast Network, FUMS. FUMS is a podcast providing information, inspiration, and motivation for living your best life with multiple sclerosis. Join host Kathy Reagan Young for interviews with doctors, researchers, scientists, patients, legislators, and more in the pursuit of answers. Check out the most recent episode on intermittent fasting with Cynthia Thurlow, a nurse practitioner, CEO, and founder of the Everyday Wellness Project. Intermittent fasting isn't just about skipping meals. Cynthia explains what intermittent fasting is, its effect on her own health, and the types of fasts that are available. For more information, visit offscrip.com/shows. The link will be in our show notes. Enjoy the show.
Hi, listeners. This is Hallie Tecco, host of The Heart of Healthcare. Today, we're going to talk about period poverty.
Do you know how it is to have to ask someone for a pad or a tampon? It's humbling to have to tell someone that I'm using toilet paper. I had to have my daughter use toilet paper. It's a nationwide epidemic, but if you think about it, anywhere the poverty exists, this would exist, and no one's talking about it because of the stigma and taboo.
That's Lynette Medley, the founder and CEO of No More Secrets Mind Body Spirituality, a nonprofit providing education, care, and period products to women facing period poverty. 49% of girls and women have faced a lack of access to sanitary products, and 79% have made sacrifices or gone with less in order to afford their necessities. It doesn't help that in most states, they charge sales tax for women's pads and tampons, and many federal assistance programs such as SNAP and WIC do not allow the use of those funds for period products. The movement for menstrual equity has been gaining traction. This movement is based on the central tenet that period products should be affordable and accessible to all menstruators. The movement aims to reduce the stigma around menstruation that has prevented legislative action towards achieving menstrual equity and reproductive education. Today, I'm talking to one of the most inspiring advocates in this space, Lynette Medley. She has been working in this space for over a decade. Her organization's mission is to decrease uterine care and menstrual health disparities in underserved communities through the eradication of societal stigmas and propagation of resources and scientifically based information. All right. Lynette, thank you for being here.
Thank you for having me.
Why don't we start by telling us about your background and what ultimately led you to this work?
Well, my background is that I've had some instances, again, with poverty and with menstrual insecurities due to, traumatic situations happening in my life, due to economic crisis. I do not hide the fact that when I was married, my ex-husband ended up being incarcerated and he's serving a life without parole sentence, and it just pushed my family right from middle class into poverty. So I changed that passion from my pain into fighting period poverty and then fighting anything else that's happening in our community that addresses stigmas or taboos around sexuality-related topics, especially affecting marginalized or vulnerable populations.
Most women living in poverty also struggle monthly to pay for period products, yet they aren't covered by SNAP or WIC. Where do you think we need the most policy change?
That's a good question. One of the biggest things is to really add it to the systems that are already in place. Creating new policies and procedures is always an uphill battle. So we already had these programs, whether it be Medicaid, Medicare, WIC, or SNAP in place to provide subsequent, assistance to these communities, then we can just add it on to them. So I think that's the best way. Add it to WIC, add it to SNAP, added to Medicaid,
Yeah.
added to Medicare, even schools that are getting free lunches. Make sure that those schools that have already been identified of students being at risk of food insecurity, of course, if they're suffering with food insecurity, they're also suffering from menstrual insecurities.
Are there states that have free available period products in schools, prisons, any kind of public space, publicly
Yes.
funded space, I should say?
Yes, there are several states. I know New York has a policy, Delaware has a policy, and some other places do, but it's a federal mandate more so. So I think one of the biggest things is them getting it's a state mandate more than a federal. So them getting the funding to implement it. Many of the state legislators are moving forward with these bills, but again, if they don't have the funding, then it's still like they're kind of, like you said, going around in circles. And of course, many of the prisons have them in place, but it's a supply chain. I don't want to say supply chain issue, but it is getting the products that make sense to the inmates and making sure that they're staffed enough to make sure it happens. So many times things are on the books or the policies are in place, but it's no way to oversee or implement that is actually occurring.
Oh, interesting. So it's like the policy is there, the funding is there, but maybe they just aren't able to operationalize it.
Definitely.
Get it to the end user. Oh, interesting.
Definitely. Or the funding is limited. It's this idea that, okay, we want to fund it at this amount, but that's just not realistic when you're really talking about the cost of menstrual products for an individual who, like you said, bleeds for, several days a week, every month, because it doesn't stop.
Okay, how about the fact that tampons are taxed while Rogaine and Viagra are not? How much of this is just rooted in the patriarchy?
It is a misogynistic patriarchal policy that has been, perpetuated for years. And it's ironic that now that we've been dealing with this tampon shortage, I'll see a lot of legislators saying, oh, this is crazy. We didn't know this. Yes, you did. We've been talking about this for years. And I think that for you to act like you're that you don't understand it is just, dismissive in and of itself. So again, anything that has to do with women's bodies, we know has been taken as secondary or tertiary. So I think one of the biggest things is realizing that we need to change that narrative and understand that just like toilet paper and paper towels and everything else and Rogaine are something that's a necessity, we need to make sure that menstrual products are not considered a luxury item, but a medical necessity.
Yeah. Why do you think there's so much shame and stigma around it to begin with?
I think that comes in this, it's a cultural and historical. When you really think of religious organizations, when you think of culturally, and when you think of conversations just around women's health as a whole, we really never completely talk about the menstrual cycle in the way that it should be presented. It's always in a negative connotation. It's just like it's nasty and it's dirty, not talking about it as a normal, natural part of life. And, I don't want to be explicit, but we'll talk about feces and urine before we'll talk about a menstruation or period. And again, I think we've been indoctrinated for hundreds of years from the society. Again, this misogyny and a patriarchal society that doesn't understand or really embrace women's health.
I feel like men are still grossed out or disgusted by periods or conversations around periods. It's almost like we don't need to be educating the women about it. We need to be educating the men.
Definitely. And then I think one of the main things too is many times when we're having these conversations, I know that we're intentional about saying we want both sexes in the room, because you can't just keep talking to one side and then expect the other one to accept it. And even when I talk to mothers or grandmothers or aunts, and I'm saying, how many times have you included your husbands, your uncles, your sons, the male person, identified persons in your household in these conversations? So again, some fault lies on many of the menstruating individuals by not, really bringing them in on these conversations and talking about the importance of menstrual health and menstrual hygiene.
So you brought up the tampon shortage. I read that the price of tampons has increased by nearly 10%. Who really hurts the most from this?
Of course, our most marginalized communities, but any menstruating individual in general. I mean, right now, everything is rising. The cost of food, the cost of gas, the cost of utilities. And, as we know, wages aren't increasing for our community, especially our menstruating individuals, because of the gender, wage gap. And now you're asking them to pay for menstrual products that are just exorbitant, in price. And it's just ridiculous, especially if it's a mom or, a mother or the daughter or two daughters. It's just something that people can't pay for. So originally most of the requests we got were people who were really dealing in poverty or, ongoing economic hardships. Now it's just like, I can't even drive to work and pay for gas and pay for menstrual products. So it's really hurting, I think, everyone in some way.
And what are people doing? What are the alternatives?
There, I'm sorry to laugh, to belly laugh like that. There aren't many alternatives. Again, like you said, we get approximately 100 requests every 2 days. I mean, there aren't any, systems set up to really deal with this issue. And I just think that it's just going to really hit an extreme crisis, just like the formula shortage and everything else. I think the more that people really talk about it, I've been in stores where we've just been looking for products and I see poor college students and they're like, oh my gosh, what am I going to do? And then you always get the conversations about, oh, we'll just give them a menstrual cup or give them a reusable pad. Again, but that's coming from a space of privilege and and talking out of your positionality, where some cultures, some religions, some persons don't believe in assertions. They don't feel comfortable with assertions. And some people don't have ongoing access to running water or waste management services, or their housing insecure. So all of these things really play a part when you're really introducing menstrual hygiene options to our communities.
Yeah. Interesting. So menstrual cups, which are becoming more popular, aren't necessarily accessible because of cost, because of the way you have to clean it and having access to privacy and clean water. That's really interesting. I hadn't really thought about that for menstrual cups. What about period underwear? I'm seeing a lot of ads for that as well.
Definitely. And the period underwear, again, is another great option. We give them out at the spot also. But again, you're still talking about needing access to waste management, running water, and a safe space to store them and clean them and all of these other things. And that's one of the things that we're very intentional about, is listening to our communities. Menstrual cups were first coming out because we do give them out a great deal. But a lot of cultures, religions, individuals do not like insertion. So again, that's a whole conversation. So again, you can't say, oh, well, just give them that. Again, you're still putting them at risk if you're not really asking them if this is the best fit for them and their bodies.
We'll be right back after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
So tell us about the work that you guys do at No More Secrets.
Thank you.
Tell us everything.
So overall, the umbrella, No More Secrets, is a sexuality awareness organization. And what we do is we tackle difficult subjects that have to do with sexuality-related topics that are deemed stigmatized or taboo in our community. Many of our earlier work was creating spaces for people based on their sexual orientation, gender identity. Then we went into the Me Too movement and talking about bodily autonomy and making safe choices and healthy relationships. And from those conversations, we realized that a lot of people were engaging in high risk behaviors and unhealthy relationships to be able to access menstrual products, that they basically were putting themselves at risk and harm just to be able to get menstrual products for them and their families. So that's when we kind of, as I say, slipped and fell into the menstrual equity period poverty space. Because again, that was something that I had experienced and my family had experienced. So again, I was really open to be able to work with our communities in this space. And right now, the SPOT period, which is the nation's first and only menstrual hub, a uterine wellness center, we opened a year ago. And in 1 year, we've serviced over, how many numbers now? About 400,000 people. And we've given out over 6 million products. So we give out around 32 to 46,000 products a week to people who basically need menstrual products. And everybody who comes gets a 3 to 6 month supply of menstrual products. So one of the biggest things that we want people to understand is the way that we tackle period poverty is really addressing menstrual health as a comprehensive system of care. So in addition to giving menstrual products, we also give uterine education, menstrual hygiene education, and resources and workshops. Once a week, we have nurses on site. Twice a week, we have med students on site. So we really try to give them a comprehensive approach to dealing with menstrual health and menstrual hygiene.
What are some other areas of care that are relevant to the clients that you serve?
Oh, everything. One of the
I
things
imagine endometriosis
yeah,
is something that's
one of
so
the biggest
common.
things,
Yeah.
yeah, so it's all of the dysfunctions that can happen or the ailments that can happen, endometriosis, PCOS, fibroids. And I think one of the biggest things is so many of our community members have these ailments, but they suffer in silence because, again, one of the huge things that is not talked about is a normal period. And once you start talking about a normal period, then you can start talking about some of the abnormalities that are happening in your body. But because our communities have been indoctrinated into thinking heavy, clotty periods are normal, they don't realize that it can be something wrong with their bodies. But also access to healthcare and insurance is another barrier that we really work with our communities to be able to go and get an assessment or be able to go and get an exam. And also connecting them with healthcare professionals that are willing to listen to their authentic experiences and voices instead of discounting it. So I think that's one of the biggest things that we work with our communities.
Yeah. Are you guys involved with the Free the Pill movement to move birth control from a prescription to over the counter?
No, we are not involved in that movement, but we do work with our communities about being able to get birth control options because many of the community that we work with are uninsured. So unfortunately, Plan B is their plan of action. So really making it accessible for everybody to be able to have proper birth control is very important.
Do you guys carry Plan B for your clients?
No, we do not carry any, I forgot, birth control products at the hub, but we refer them to where they can get them from.
How does or how will the repeal of Roe v. Wade impact your work?
It's funny because, I mean, in all actuality, Roe versus Wade was the law to provide access to abortion. But most of the populations that we serve were never still able to access the abortions because Medicaid didn't pay for it. After the Hyde Act, all of the things that would allow many of the people in our communities to access abortions still weren't in play, from paying for them to transporting them to where they had to go for childcare. So I think I'm a very big advocate of really telling people if we try to get it, Roe versus Wade reenacted, I think we need to look at reproductive and menstrual health as a system and look at everything around women's health that needs to happen.
Do you think that this is just the first of more legislation that rolls back reproductive justice?
I do. And I think it's because we're so segmented. I think because, again, everybody operates in a silo. It's like the abortion people are here, the maternal health people are here. I don't think that we come together as a collective force. And I've been advocating and telling people this is the time for us all to come together and look at it as a whole system. Because what they do is they piecemeal things and pull things back. And it's just like, oh, we're over here. And again, if we looked at women's health in totality, then we can really address the deficits for all of our persons in our communities. And I think and again, the foundation of it all is menstrual health. So until we address menstrual health, I think we're going to deal with all these. I always tell people when they're coming to me, I have families, like 3 people are sitting there pregnant, because, they're coming with their children. And again, where the real, the baseline is when people become reproductive beings to really start having these conversations. So if we can all come together, I think that way we can really address some of these laws and legislative decisions.
Yeah, certainly there are organizations that are just so underfunded. They probably don't have the capacity to come together. So you almost need kind of a convening group that will help make it possible, because otherwise all these nonprofits and organizations that are working in piecemeal pieces of women's health, just like I feel like are stretched so thin. And really, maybe it starts with funding. Maybe it starts with actually putting real resources into women's health.
Definitely. I totally agree because we're not funded at
Yeah.
all. We're not funded by the city, state, or federal government. All of our funding is from donations and private donors. So I definitely understand
Yeah.
the funding piece, but
Yeah.
also I do reiterate that it has to be a willingness for people to look outside of their lane and realize that we
Yeah.
need to look at this in a comprehensive manner and not think that lane is the only lane that's important to our communities.
Well, it's interesting that you say kind of the foundation of women's health is menstruation. I mean, it's for probably the majority of females, their first encounter with kind of the medical system, the first time you're using a medical product.
Definitely.
The first time you might be feeling symptoms that are abnormal. And it's a universally shared experience for young girls.
Definitely. And I think that's
Yeah.
the onset is when many people feel as though they've been overlooked and denied. If your first experience is with your menstrual cycle and you're not provided the basics, your basic needs of care, then that's how you look at the system as a whole. I mean, and that's your first viewpoint of the system. And
Yeah.
unfortunately, that's what's been happening for years.
Yeah. Do you feel like the stigma and shame around periods for young girls? I'm thinking back to when I was horrified getting my period in gym class in middle school. Is this kind of like a universal stigma? Is this something that women around the world feel? Or have there been cultures or societies that have kind of viewed it in a more positive light or have not had that sort of stigma around it?
Well, I mean, it does depend. I mean, there are some cultures and groups that celebrate the menstrual cycle. They actually have period celebrations and certain cultural, aspects. Some parts of Africa and different areas, and then some groups as a whole celebrate it. But I think overall there is this stigma that exists. Again, I think we've been indoctrinated with it for years. That is something that's negative. But it's ironic that the younger generations that are coming up, they have a different ideology. Many of them have this idea that they feel proud to have menstrual cycles and periods, and they celebrate it in a different way than me and, my mother or grandmother did. Even my daughter is more open around the conversations. And really, I think even when she got her period, it was just onus of it because we had talked about it so much. So I think that we can really push it for more people to talk about it. Again, I think from people thinking of it as something as a negative thing, I think that's why we don't have open conversations about wants, needs, and desires as it relates to menstrual health and hygiene.
And what age do you start talking to young girls about this?
7,
Wow. And what's the average age of starting your period now?
9 to 10.
Yeah.
Mhm.
And it's getting earlier, right? Isn't that the case?
Definitely, it is. Now,
Yeah.
my daughter has this idea. Now, remember, her master's is in animal science, so don't think I'm talking off the top of my head. She was thinking that because so many, people are eating the different meats and different things, and she said that meats are injected with different hormones because the animals don't produce at the rate that they used. So to produce more and more, they have to give them hormones to be fertile more often. So she said,
Yeah.
and their living increase. I was just like, oh, wow, I've never thought about that. So yeah, it's earlier.
Yeah.
So I'm like, yeah, you might have some
And
truth to that, Naya.
well, there's no way that a 9-year-old has this sort of cash to pay for these products.
Oh my goodness.
And if they're in a family that can't afford it, what do they do? It's like, it has to be really scary for them every month.
It is. And they use whatever they can. We have people who use socks, they use gloves, they use pieces of sheet, they use paper towel. It's almost like a normalcy, like it's been normalized that paper towels and toilet paper is okay to use.
Yeah.
But again, I think because we haven't created spaces to really articulate that this is a need. And even when they're in the schools, many of the stories that we've received is that some of the nurses charge you for the products, or they'll be like, they'll assume that you don't have them because you left them home and you weren't prepared, not really opening up the dialogue that I might not be able to afford them. So again, that's some of the issues. And so people stay home, We have families said that it was 6 or 7 young people in the house. And they said every month we would just stay home during menstrual cycle because it was too embarrassing to go and have to ask for products or leak through our clothing, which started this spiraling because I only have a couple of pair of underwear, one uniform, and all of these other expenses that would be added by not having access to menstrual products.
And if you have a heavy flow, if you have a 5 to 7 day flow, it's a big portion of your life that you're focused on this problem.
Definitely.
It's like very big quality of life. How much does someone spend on average a month on menstrual products?
It depends on their flow, which I will say again,
Yeah.
but if you have a heavier flow, if for 1 month you're buying two packs of, or 2 to 3 packs, you're spending like $30 a month. And when I'm saying
Yeah.
packs, it could be your menstrual. I mean, because you might buy your pads and you're getting your panty liners. And then also people don't think about the wipes that people get or the pain relievers that they get. All of the expenses that come with being able to properly take care of your menstrual cycle. So, and then you're multiplying it by multiple people in the house, because it's so ironic that you asked that, because there's been this ideology about these period packs that some organizations have been giving out. And they're like, oh, well, a normal period only would take 3 pads or this. And I'm like, who has these normal periods? Because everybody who's coming in, like, they're like, I need a pamper, I need a poise pad, I need whatever. So again, really listening to our communities and listening to what they need to meet them where they are. So it's very expensive. And those thicker, bigger packs of pads are just ridiculous now. Even on Amazon, I think the other day we saw something for $17 and $13. So it's just really, people are priced out. I mean, it's ridiculous.
Yeah. And the prices are increasing with this tampon shortage.
Definitely. And unfortunately too, you know how we talk about food deserts? Most of our communities are in deserts as far as any type of toiletry. They have these stores that already add extra money to whatever. So they got these corner stores. We went into one store and 1 pack of pads was what, $15? The corner store?
Oh, it's $20.
Yeah, $20. $20. Because they don't have maybe the CVS's or the Walgreens or in their communities. It's a desert as far as even getting toiletry products.
Wow. And so if someone is trying to extend the use of a tampon or pad, what are some of the health risks that they could face by doing that?
Oh, they can get toxic shock syndrome. They can get vaginosis. They can get urinary tract infections and diseases, which can lead to different forms of cancer. It really puts in. One of the other things is also something that is a deterioration of the vulva. So they basically get it's almost like diaper rash, where the skin on the vulva is basically deteriorating because you're sitting in moisture. So all of these things can really cause issues. And we have really been trying to talk to our communities about the safety issues around using menstrual products for too long, or using a used menstrual product or anything like that. So again, it's just really a lot of risk to our communities.
Yeah. I mean, it's so crazy to me that we treat these medically necessary products as a luxury good.
We do. And it's ironic.
That's
Even when you're
crazy.
talking to people, they're like, I never thought of that. Because again, I always say sometimes we don't realize our own privilege and positionality, because we've always had access. There are more conversations now because of the tampon shortage, but this is something that people are struggling with every month. And it's not a lot of resources out there.
Yeah. So are you optimistic that this problem can be corrected? And if so, what is it going to take?
Definitely. I'm always, you have to be optimistic. You work in this space every day. Definitely. I think that the government will make them a medical necessity. It might start with our most marginalized populations. Again, it might start with adding it to Medicaid or WIC or SNAP. We've been in talks with some legislative bodies about how do we move forward with doing that. And so at least if we could start there, and then we can build on top of it as being able to give it to more of our communities. I definitely think if they can just understand that this is a medical necessity. That's what I keep saying. Band-Aid is a medical necessity. Come on, a menstrual product.
Yeah.
So I think that we will. I think it'll happen. Of course, it won't happen overnight, but I think we will move in that direction.
Yeah. Well, hopefully the shortage will at least have these conversations up and front and center for a lot of the legislators that might have just ignored the topic before.
Definitely, especially considering during the national pandemic when 80-something% of women were losing their jobs, they added it to flexible spending. And didn't add it to Medicaid or Medicare, which was interesting to me. Maybe they'll go back and look at how they added it to flexible spending or HSA accounts and say, hey, why don't we put it to our most needy population? So
what's next for you in No More Secrets?
So, we recently launched the world's first mobile menstrual health clinic. So it's a mobile menstrual health unit that rides around from state to state, city to city, and really educate people around menstrual health and wellness. We really talk a lot about sustainable options and reusable options, the communities that can use it, and also just talk about what periods are. That's been our next venture. And then, we just really want to expand our reach and really make sure that more people have access to menstrual products and menstrual education and just women's health, access to information around women's health. So we are, partnering with other universities and schools and different other organizations just to put a footprint to make sure that we save our most vulnerable communities. In addition to our communities are now inundated with these economic hardships related to menstrual health and hygiene.
And how can people support your work or get involved?
They can get involved. They can go right to our website, nomorесecretsmbs.org, and everything is laid out. They can donate through our GoFundMe or our PayPal. We also have an Amazon wish list. And they can go in there also to volunteer, or they can do a drive, and I think that's the biggest way that you can support us. Again, volunteers are always there. We're always open. And we just really appreciate people just spreading the word. And I think the more we talk about this, the more we'll dismantle the stigmas and silence around this epidemic that's affecting so many people in our communities.
Lynette, thank you so much for your work in this area and for being here with us today.
Thank you so much for having me. I appreciate it.
Thanks for listening to this episode of The Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of OffScrip Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our senior producer is Brianna Seeley. Our intern is Antonella Sterniolo. Our host is Hallie Tecco. It is recorded, mixed, and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. That's media@offscrip.com. For more information, visit offscrip.com.